So I'd like to start today, first of all, by offering my heartfelt, deepest sympathies to everyone who has lost someone during this COVID pandemic. It's difficult to lose a loved one no matter when it happens, but during this pandemic, where we've had to make visitor restrictions, where we've had to have less contact with your loved one, and where things have changed so dramatically, I can only imagine how difficult it is to have lost that person. And if you add to that the fact that you may have questions, concerns, fears that your loved one wasn't well cared for in the last weeks or days or hours of their life, again, terrible tragedies, it must make it so much more difficult. And I'm very sorry to all of you who had to go through that. I'm also here today to offer apologies to all who feel that we've let them down. We'd like to give you our assurances today that we are doing all we can to provide a safe environment for everyone that we care for, including all of our residents, all of our patients, and our staff.
You said that Revera had less than fulsome information that was given to you. Can you expand on that? And do you believe that you were deliberately misled and lied to?
So we were attempting to find out how this information got relayed to us and why it was put out in the format that it was done. I think partly it was pulled together very quickly, and there were assumptions made in that information apparently that just weren't correct. So it's part of what we're going to be discussing with Revera on what we need from them when we ask them for information, what we expect from them, and when we say was there full staffing on, and we hear that there were 13 of 15 healthcare aides, that led me to believe that the normal staffing would be 15 and that there were 13 on for that full shift, and we found out that that was not correct.
If the information you received was incorrect when we're talking about an incident that has raised huge concerns, how do you see red flags here that information that has been given to you guys from Revera over the past 72 hours and in previous weeks was correct? How do you believe it?
So as I said, it certainly puts a strain on our relationship when we find ourselves faced with this, and we are going to be pursuing with Revera what our expectations are, and we're going to be putting in place mechanisms and people from WRHA who will be able to verify information coming out of personal care homes.
Chief John Lane this morning said that a similar incident had happened at Parkview Place throughout this outbreak. Can you give us information on what happened there?
I'm sorry, I missed the first part of that.
Sorry, WFPS Chief John Lane this morning said that a similar incident with paramedics being called to Parkview Place during an outbreak had happened, a similar incident to what had happened at Maples. Do you have information on that?
So Gina will have the specifics on that, but before I turn it over to her, I just want to say that when there is a deterioration in a patient's condition that's unexpected, and if they are critically ill or become suddenly very ill, the usual process is for the personal care home to call for assistance from the paramedics and to in all likelihood to transport that patient to hospital. So I would expect that has happened, in fact, where paramedics have been called to come and attend, but perhaps Gina can expand.
Yeah, so we've got 38 personal care home facilities in the Winnipeg region, and certainly from, facilities do not contact us every time that they, call an EMS or 911 at a facility. I did learn after this morning's press conference with Chief Lane that there was a period of time, a particular day in October where there were several ambulances called to Parkview, and I did just learn that this afternoon, and we will certainly be reviewing that after this.
Saturday during the nighttime news conference that was held, both the WRHA and Revera disputed claims made on that Reddit post that eventually led people to learn about this situation. This morning, Winnipeg's Fire Chief John Lane corroborated those claims made in that post. Does the record need to be corrected on that as well?
So I'm not sure what specific claims you're speaking of. We are saying that the staffing was not as was portrayed. We do know that there were residents who were extremely ill. There were a number of residents who were treated at the home and did not have to be transported to hospital after that. Some of them with intravenous therapy and some of them with assistance and other things. So we are, I think, very much saying that the information, we are trying to correct the information that was given.
Okay. Families, unions, they say they've been raising alarm bells for weeks. Why weren't they heard before this? Why to be blunt, this seems very reactive, even in the face of families and unions who have brought these, who have said that they have brought these to your attention, to Revera's attention. Why is this? Why weren't they heard?
So I can't answer that specifically. I can tell you that we are putting WRHA staff in place to be the ears for us, to be the responders for us, to hear people's concerns and to help us resolve those issues. Whether those issues were getting through to WRHA or not, we won't know, but we do know that from this point forward they will, and we will be responding.
Okay. On Saturday, Revera's VP, who you guys have talked about now, said that when family members would bring up the issues with healthcare aides on the floors, he quote unquote said it was optics due to those healthcare aides being busy in patient rooms. That obviously doesn't seem to be the case. I really, what is the message to families who've essentially been lied to here?
So what I'm saying to families is we've let you down. We gave we accepted and transmitted incorrect information, and we are here to assure you that we're going to do it differently, that we will be on site, we will be there to make sure that what we're hearing is correct, and we will correct situations where they exist.